Good afternoon. This is Media Center Ukraine, Odesa. We continue our briefing day, and now we are going to discuss the results of work of the Odesa Regional Blood Transfusion Station. And we are having with us Maryna Tkachenko, the medical director of the station. Good afternoon, dear ladies and gentlemen. First of all, I would like to thank everyone who at such an important time has joined the donor cohort, saving numerous lives. Thank you very much for your sacrifice and important contribution to our victory. Using this opportunity, I would also like to thank the Health Department and Odesa Oblast Administration for significantly supporting blood transfusion service and developing donation in Odesa region. Thanks to them, we received a car which we used to organize donation drives in institutions of the city of Odesa and Odesa Oblast to increase the blood amount in blood bank. I would like now to briefly tell you about the blood donation system. Not all know about how it is organized, although we cannot do without blood donation system. The system in the Odesa region consists of Odesa Oblast Blood Transfusion Station, 11 transfusion offices, including 4 in Odesa, and 19 blood transfusion rooms. You can come to these facilities to donate blood and to save someone's life. Before the full-scale invasion, the region was reorganizing the blood system in line with the order of the Cabinet of Ministers of Ukraine 100R and the law of Ukraine on blood quality. The reform envisaged the establishment of the single blood center and regional offices. So the reform envisaged a centralized system. The Regional Transfusion Committee was established at the beginning of the reform, and we also developed the program to achieve defined objectives. But unfortunately, the war has changed everything, and we have had our own challenges, objectives, and tasks to ensure the significant amount of blood and blood components in Odesa Oblast. Despite the fact that we were different in the system, but we managed to create the whole mechanism aimed at supporting reading to fully meet the needs with regard to donor blood components. And you know that our country is invincible, and people just get united as soon as they face challenges. From the first day of the full-scale invasion, the blood system has been able to provide the needed amount of donor blood and donor blood components, and we have been also supporting the neighboring oblasts, Mykolaiv and Kherson, in supplying materials for blood donation, and also backing them up with donated blood, and we also ensure the mobile brigades and groups for the armed forces of Ukraine. Despite the military aggression in 2020, the amount of donations increased by 20%, which speaks about the heroism of our donors that continue supplying the donated blood in the region. This also means that we believe in our victory and do everything possible to approximate it. You say that in 2022, the amount of donation increased by 20% comparing to 2021. As for the blood donation, and I hope that more people will learn about this to increase the number of donated blood. A donor could be citizens of Ukraine or a person having residence permit in Ukraine. A person should be at least 18 years old, over 50 kilos, without chronic diseases. There is a simple diet. There should be a 2-day diet prior to donation, without alcohol, fried and spiced food. You should sleep well before donation. Do not forget your ID. To drink tea with sugar or honey in the morning. It is also allowed to eat cookies, and then you're ready to come to our center. There are myths about blood. And I also like people asking questions about this myth. And we also have the information on our website and on our Facebook page. So we should all be involved in blood donation to join the donors' forces of Ukraine. And I would like to wish quick victory to all of us. So you can donate blood not only in the biscuit lane, but in other places. Yes, we have 4 premises. This is the regional hospital in Zabolotnovo, the hospital number 11, and also Odesa Clinic Center. So you can address these clinics or hospitals to donate blood. We also actively cooperate with Donor UA and blood agents. There you can also learn the schedules of our operation, and you also can learn about the demand for specific blood types. But I would like to say that we need all blood types, and even if you believe that you have quite popular blood type, you should also donate blood, because this means that if this is a popular blood type in donors, then this is also a popular blood type in those people who need transfusion. That's why we need all blood types, and we are waiting for your donations. I remember that at the beginning of the war, people were urged to donate blood in the Odesa military hospital. Did they cooperate with you or not? The Odesa military hospital also collects blood to stockpile it mainly for the armed forces of Ukraine. We also provide blood components to them. You can also donate blood there in that hospital, and you can also find the contact details of the responsible persons. In March, if I'm not mistaken, there were huge queues of people who wanted to donate blood, and they didn't have even enough time to donate blood by 3 p.m. That was when the hospital was closed. And usually you need 1 hour for one person to donate blood. So the blood donation takes around 5-10 minutes, but you also need time to register. You need time for the examination by a therapist, and of course we need time for every person to donate blood. On our site, you can register for blood donation, and you can also choose the better time for you. Donor blood is very important, but it has its own shelf life. So if you collect too much blood, we might have not enough time for the transfusion. The donor can recover only in 60 days after the blood donation. That's why we need to plan on the activities. And Donor UA has a donor diary. You can register there to have better understanding where you can donate blood, not to spend much of your time in queues, and also to make it easier for those people who examine the blood and produce blood components from the donated blood. So we can donate blood once per 60 days. Yes. So once per 60 days. Thank you. Thank you very much for sharing these details. Hopefully this will increase the number of donors in our system, and that will help our military and wounded. Thank you. That was our last briefing for today. We will get back here tomorrow, so please follow our announcements on the website and on the Facebook page. Thank you.